Hello, welcome to the PT channel again this week, and this week we'll be looking at some BBL gone wrong. Let's see some videos. She does look good. Yeah, that is BBL. So a lot of people here only BBL, BBL, BBL. So what is BBL? BBL is Brazilian butt lift. This is like a transfer of fat from maybe the tummy, like in that lady. We transfer that fat from our tummy wall. So that's like the fat in our abdominal wall. And I think just move to her butt. Yeah, and she does look good on it. However, today we'll be talking about the risk associated with BBL. And just for you to have an idea of what BBL is about, and absolutely, it's a game changer for people who are uncomfortable or they want like more, they want to become more shapy or look nice. Yeah, have a dress and you look nice in your dress. Everyone absolutely wants that. But it's also important for you to know the risk involved and absolutely talk to your plastic surgeon or whosoever is doing it so that you have a comprehensive overview of what you are going into. So we'll be showing you some videos of some BBLs gone wrong. Does she she looks, that looks like her hip is tilted to one side. Oh dear, no offense, please. What is this? This is absolutely not right. That's not right. Absolutely, that doesn't look nice. And I don't think does she know or not? I'm not sure. So BBL is generally a safe procedure. It is now in vogue. A lot of people are doing it to become, to look well, or a lot of women are doing it to appear well, to look more curvy, shapy, and just to look nice generally. It's like I said, it is generally a safe procedure. However, in some situations, it can lead to collection of blood in the under the skin called hematoma. It can also lead to death of fat tissue, so the fat tissue that is being transferred, or during transfer or after transfer, it can lead to death of fat tissue called, and this is called fat necrosis. And like this first video of the BBL gone wrong, you can see that the other side appears to be bigger than the one side appears to be bigger than the other side. So apparently, or I think it may be that that side that is smaller may have experienced fat necrosis. And also, one of the complications of the surgery is fat embolism, in which fat cells moves from where it is transferred to and enters into the vein and or blood vessel, and it can go to the lungs or to the brain. Fat embolism, it's dangerous, it's a bad complication. Then absolutely also, after it is healed, because remember it is a surgical procedure, it involves transfer of fat from one area of the body to the other, so it actually heals. And for some people, the scars can become hypertrophic, in which the scar becomes big and unsightly. Even some people can form keloids as well. And any operation carries the risk, apart from this specific side or risk to the procedure, general risk that happens or occurs in any operation can happen as well. And there's risk of infection, excessive bleeding during the procedure, even after the procedure. There can also be allergic reaction to the anesthetic. So it is important for you to be aware of what you are going into, have a proper discussion, a conversation with your clinician or whoever is doing the surgery, so that you take an informed decision of what you're going into. And occasionally another operation might be needed, so some of the fat that is taken from the tummy or wherever they're taking it from to the butt, which is the BBL, may not survive, so they may need to do another operation as well. And just to know that BBL carries the highest risk of complications for all cosmetic surgery, and the commonest risk, or the main concern in BBL is when the fat moves from where it is transported to and blocks a blood vessel in the lungs, causing embolism, which can be fatal.